Welcome to Then and Now, brought to you by the UCLA Luskin Center for History and Policy. We are dedicated to studying change in order to make change, linking knowledge of the past to the quest for a better future. Every week, we interview thought leaders, historians, researchers, and policymakers about what happened then and what that means for us now.
Welcome to Then and Now. I'm David Myers, your host. I'm pleased to welcome today Peter Baldwin, Professor of History at UCLA and Global Distinguished Professor at New York University. Peter is the author of a long string of books in European and comparative history. Most recently, he has published with Cambridge University Press, Fighting the First Wave, Why the Coronavirus Was Tackled So Differently Across the Globe, which we'll be talking about today. Welcome, Peter.
Thank you. Thank you for having me.
Great to have you. So let's jump right in. You wrote this book in the midst of the pandemic. What was it like to deal with such a rapidly moving target in which the grounds of scientific knowledge seemed always to be shifting?
Well, yes, the frustrations of contemporary history, indeed, in this case, almost sort of instantaneous history, are many. Above all, the fact that the story is never over when you're finished with it. I would, of course, have loved to be writing the book still as we speak, and there would be another 2 or 3 chapters added to the story as it is. So, in a sense, of course, it's really just a first draft. But the fact that it could be done at all bespeaks the miracle of the internet and the extraordinary amount of information that not only is out there now, but that sort of began to well into it from the very beginning. And above all, I think it's fair to say that this phenomenon of scientific preprints is a fantastic development that is, if anything can be a silver lining for something like this, that has got to be part of it. The way in which the scientific information was posted up online, available to everyone, rather than being hoarded away for future publication in prestigious journals, for the purposes of career making later on, it has been an absolute game changer, as one says in the biz.
So what actually did you see, though, that screamed out to you, I need to write a book about this? Many less courageous souls would be daunted by the rapid pace of change. You obviously saw something that you felt merited not just the attention of an op-ed piece, but a whole book. And what is it that you were seeing?
Well, this is, of course, my own personal predilection. I mean, I've written 2 books on pandemics in the past, in the 19th century. And I thought, here I am sitting through essentially the same thing on an even bigger scale. Should I not try to take a whack at it? Now, granted, everyone who could write and had an internet connection, became an overnight expert. And so does the world need yet another book or op-ed piece on the topic? Probably not. But I thought it was worth making an attempt to see whether or not a historian's perspective might bring something, whether there were similarities to what had been done in the past, differences, and that sort of thing. I mean, obviously, I don't have the medical or even public health expertise to weigh in on that end of things. But, in terms of the continuities and in terms of the similarities between what was done this time and before, there I thought perhaps there was something to add.
So the Luskin Center has the mission of bringing historical perspective to bear on key issues of the day. And you have, at various points in your career, exhibited a keen interest in contemporary history, or as you referred to just a minute ago, instantaneous history. What is it that draws you to that? What do you think historical perspective can add? Or perhaps looking in the obverse, what's missing from public discourse that you think this kind of approach adds?
Well, take it from a purely selfish point of view, from the historian's craft and guild. The pandemic is, in effect, the largest social experiment that's been rolled out on a global scale, since the Spanish flu of 1918. I mean, when was the last time something more or less the same hits every one of the 200 some odd nations in the world, more or less at the same time, with more or less the same problem? It's, in a sense, an intellectual dream come true from a social scientist's point of view, to see how all these various societies dealt with the same problem at the same time in so many different ways. At least you're holding one variable constant, and you can look at all the various things that diverged. And in a sense, from a historian's purely sort of narrow-minded, selfish point of view, writing is so much harder than revising. So getting what admittedly is only a first draft and will never be more than a first draft of the story out there is easier than it allows others to sort of revise and correct. And I think in the sense that's sort of easier as a collective endeavor than sort of getting the first tracks laid down. So I thought, why not take a whack at sort of at least sort of figuring out which direction the path goes, and others can pave it over in the future.
Right. In that regard, Fighting the First Wave is itself a version of a preprint, and it will elicit the attention of critics, and you or someone else will produce a more definitive account, perhaps at some later point. But you've been repeatedly drawn to contagion, disease, and state responses over the course of your career. Why is that?
Well, they're an interesting topic in and of themselves, but they also pose a fundamentally political problem that I think is fascinating, because contagious disease is the only way of fighting it is through sort of public goods, through decisions that are taken collectively. Individual attempts to deal with the issue involve effectively running away and sitting in a cave somewhere and trying to survive until it's all over. But for societies as a whole, and for governments above all, for states, it means sacrificing some people on the altar of preserving other people. And so those who are contagious, those who have come into contact with contagion, those who are potentially infectious, travelers, people from elsewhere, people who have been in contact with the contagious, these are the people who are potentially dangerous. And if we're lucky, they are in a minority and the majority still remains unaffected. And they have to be rendered innocuous for the majority to survive or to pass through this. And so, in effect, it sort of poses, contagious disease poses the fundamental political problem for any state. Whom do you sacrifice for the benefit of the greater good? It's a sort of, it's a kind of problem in any community. And that, it seems to me, is what makes it so fascinating and what allows it to sort of boil to the surface a lot of the social tensions. Who is it who's being victimized? Who are the victims biologically speaking, and who are the victims who are socially chosen to bear the brunt of the disease? And it varies a lot. It's not. In this case, it has clearly been the poor, ethnic minorities, women to some extent, insofar as they bore the brunt of sort of housework and sort of maintaining things at home when everybody was stuck there, and that sort of thing. But of course, in other diseases, in the past, it hasn't necessarily been that. Some diseases, have the burden has fallen heavily, for example, on the trading, on the merchant classes, in cases where quarantines were widely used, and of course, and they've complained accordingly. So it's what's interesting is how society chooses who is to bear the burden.
Yeah. Right, and we'll talk about this later, but I mean that intrinsic majoritarianism of sound public health to produce the greatest good for the greatest number of people can be exclusionary, and the decisions can be and have been over the course of time, as you've suggested, based on considerations other than public health. Those less fortunate or lower on the socioeconomic ladder or disfavored minorities presumably have not been included in some, I assume, previous instances of large public health responses. But maybe we'll get back to that majoritarianism a bit later. You referred to the crisis, the COVID crisis, the coronavirus crisis, as global in scope, and yet the responses that you chart have largely been refracted through the prism of states. I'm wondering about the history of contagions that you've examined over the course of your career, the 1918 flu, the SARS outbreak, the AIDS, HIV crisis. And, before we get to COVID-19, can you tell us about successful state interventions in those instances?
Ooh, okay. Well, that's hard to measure because, in the past it was, how did you know if you'd been successful? Some countries tried and to wall themselves off, and were on the sort of periphery of travel routes, and managed to do so with some success. In the 1830s, Sweden was a peripheral country that decided simply to close down incoming traffic, and I can't tell you off the top of my head whether what the sort of infection rates were compared to other countries in Central Europe. But it's certainly plausible to imagine that it could have been worse had they not done that sort of thing. I mean, one of the interesting things in this pandemic has been, of course, the extent to which, in the beginning, before we got vaccines, the techniques that were available were in effect those that have been available since biblical times. Contagious disease, if you don't have a medical solution to the problem, in effect means that you have to separate people, you have to keep the contagious away from the not yet infected, and you do that by means of quarantines, shutting down travel, isolation, keeping people apart from each other. There aren't really any other techniques available, and those were the ones that we had in the beginning of the technique. Masking was perhaps sort of the one little wrinkle. I mean, people didn't. Well, even that in the cholera epidemics of the 1830s, the people who went in, sort of fumigators and people like that, who went into the really stricken areas of cities, would sort of get dressed up in some kind of waxed linen gowns with masks and that sort of thing. So in effect, we've had that as well for quite some time. So we're really using very venerable tools of public health disease management because there were no others. So in a sense, history bore very heavily on the response for the first 9 months at least.
Right. I mean, with all of the advances in medical knowledge and the extraordinarily rapid development of a vaccine, the techniques deployed, it seems, in this crisis were, as you say, very tried and true, extending back to the book of Deuteronomy and Leviticus, as you quote in your book. And I guess that leads me to ask, what received wisdom did past pandemics bequeath to public health experts dealing with the current pandemic? What best practices other than quarantining made their way down? You note in your book that we know what we know about the coronavirus medically has had surprisingly little influence on government responses. So I guess the question is twofold. What wisdom did we inherit alongside quarantining? And why was that that advice or that sense of medical best practices not especially influential?
Okay, so two parts to the question, two parts to the answer. The kinds of things that we inherited were, as I say, distancing, quarantining, keeping people out. And the interesting thing is actually that many of these practices, especially, for example, shutting down travel, were now regarded by the WHO, for example, in the beginning as being sort of, old-fashioned, outmoded. We really don't do that anymore. Why should one shut down travel? Because ultimately there's so much travel that you can't really keep it out, and therefore, there's no point to it because it'll seep in anyway. There was a kind of, collective bien-pensant wisdom that went against some of these, as were inherited techniques, but that then actually turned out to be wrong. And I mean, the WHO. And many national governments would have been much better off had they shut down travel from the word go and done so early. I mean, we now know that travel restrictions, in fact, work very well if you can do them. Some countries have a much easier time doing them. If you're New Zealand, if you're Australia, not to mention North Korea, you really can limit travel coming in. If you're the Netherlands, it's obviously a rather more difficult proposition. If you're the U.S. and you try to prevent travel between states, good luck with that. So, it works in certain cases and not in others. And in that sense, one could almost speak of a kind of revival of old techniques that had been thought to be sort of outmoded and almost quaintly old-fashioned instead. So then, you want to come into that, or no? Go ahead to the other part of your question, which is so the medical knowledge. So that was, of course, an ongoing, moving circus. So in the beginning, for example, we thought it was passed along by droplets. Aerosol wasn't sort of thought of as being quite so important. So that meant that you should cover your mouth when you sneezed or coughed, but masks weren't really that crucial. Later on, when we realized that it was actually aerosolized transmission that was more important, then suddenly masks became a possible way of cutting transmission. So then, suddenly masks were, began to be recommended. The WHO, again, had recommended against masks in the beginning, not so much because they didn't think they were effective, because they were worried about shortages and not having enough masks for medical personnel, but that was because they were thinking of these particular medical grade disposable masks, of which there weren't enough in the beginning. But it was only sort of later that they then discovered that homemade cloth masks actually did a pretty good job of it too. And when you accepted that an aerosolized transmission was a big part of it, then that was worth recommending. Asymptomatic carriers. Again, in the beginning, we had no idea. Some diseases, when they hit, people have very clear symptoms. They feel miserable. They tend to stay at home. You don't have to worry about them wandering around. But after a while, it became clear that a large part, sometimes up to half, but certainly 30% of people with COVID were asymptomatic. They had no idea they were diseased. They wandered around. There was no way of saying, stay home if you feel ill, don't go out, because these people didn't feel ill. And so suddenly, if you have a lot of asymptomatic carriers, then you have to start worrying about techniques like testing them and tracing them. You have to worry about closing schools, because even if kids don't get sick, they may be a means of transmitting asymptomatically to their parents, to their grandparents, to others. So suddenly a whole new set of public health interventions open up based on what you know medically, but didn't know up to a certain point. And then above all, the whole question of the immune response. Up until the vaccines turned out to work, we really didn't know very much about the immune response, whether there was one, how long it was going to last. We were incredibly lucky as a species to discover that there was an immune response. But many nations built their entire response on the assumption that, on a number of assumptions, either not taking for granted any sort of immune response, which is in effect what countries like New Zealand and Australia did. I mean, they're still sitting in lockdown, not really having vaccinated, having solved the first problem, but not having sort of adopted the exit strategy that vaccines now allow them. And other nations, in contrast, like Sweden, assumed that there would be a kind of natural herd immunity when enough people were infected just by the disease spreading through the population, that it would then sort of shut itself down as people develop this herd immunity. But when they took those decisions, they hadn't a clue. It was completely on a song and a prayer, and they were hoping for the right outcome, and they never got it. There doesn't seem to be any likelihood of attaining natural herd immunity to this disease. That's often the case with many diseases. And the idea that you would bank on that as a strategy is fundamentally misguided. And yet politicians decided to do so, as it were, even in the absence of any reliable scientific knowledge about it.
Well, I'm struck by sort of the shifting winds of scientific knowledge, especially around masking, because it seems like you're suggesting, we would have been better off to just adopt the old biblical and late 19th and early 20th century tactics of masking, quarantining, and travel restrictions, and forget, what the size of the aerosol droplets were. Those were, at the end of the day, the tactics most successful in preventing the spread of the disease. And scientific knowledge sort of complicated the story. This constant, fast-moving, latest update from the scientific front actually complicated and in some sense retarded the progress in preventing spread.
Sure, but turn it the other way around. Scientific knowledge was always about trying to push back on these techniques. Of course, you're absolutely right. If we had been able to say to everyone, stay at home, do not go to work, insofar as you have to leave the house, put on a mask, do not travel, do not admit any travelers from elsewhere, and basically just shut down society. That would, of course, have cured. I mean, in theory, you could have shut down the entire globe for, let's say, 3 weeks. And after those 3 weeks, the globe would have been back in the same position it was the day before patient zero. And then we would have started all over again. The practicalities of doing that, of course, were daunting, not to say impossible. And every scientific intervention here had to do with how do we avoid this maximum solution that you've just described, which of course would be effective, but would also bring the economy and everything else to a grinding halt. And in effect, that whole, modus vivendi that we worked out in the industrialized world, where 40% of the population work to keep 60%, allow 60% to stay at home, that of course, that wouldn't have worked either. I mean, we're talking about 2 or 3 weeks of complete shutdown. So people would have gone hungry. Emergencies would have gone unanswered, and it would have been dreadful in its own way, but it would have been effective.
Kind of breathtaking, I have to say. It's kind of breathtaking, that sort of internationalist utopian fantasy that you're spinning. Like if we shut down for only 2 or 3 weeks, we might have prevented the extraordinary destruction that this virus wrought on billions of people. And yet, the cost-benefit analysis would yield, might tip in favor of this very patchwork series of responses that we've seen.
Sure. I mean, we can't possibly underestimate the costs of 3 weeks of complete and utter shutdown. I mean, we're talking starvation and things like that. Not everybody has 3 weeks of, tuna fish in cans sitting in their garage, or much less anything else. So that would have been a very harsh measure, to say the least. So the point is that the scientific knowledge was always used in an attempt to loosen up this maximalist solution. You could go out, but you had to wear a mask. You could go out, but you had a distance. You could work as long as it was behind plexiglass. All those sorts of ways of sort of allowing more normality than would otherwise have been the case.
In the name of reckoning with political, social, and especially economic realities.
Well, exactly. So, those countries that were most successful in the first public health phase of the pandemic were those countries that could either just order people to stay at home, like China, or count on the buy-in from their citizens that they agreed to stay at home, which were a number of other nations: New Zealand, Australia, Taiwan, South Korea. These were nations, Japan, I think, to a large extent, these were nations where people were willing to go along with it. But then there were nations where political leaders simply could not count on the cooperation of their citizens, and those nations include basically every Western industrialized democracy. The West has not come out of this pandemic looking good. There have been so many reasons why our mortality rates are among the highest in the world, even though, supposedly we are better able, richer, more capable, better administrations and all that sort of thing, and should have been able to deal with this much better than we did.
So let's drill down on that. You write in your book, neither political system nor science explained why nations differed so dramatically in fending off the pandemic. And you make the case throughout the book that you can't generalize that democracies did better than autocracies in dealing with it, or the opposite, as one could mount arguments for either side doing better. But in fact, there's no general rule. So what ultimately did matter? What is it about that collection of nations, states that you mentioned at the outset?
Yeah, there's no general rule. Some autocracies did badly, and some democracies did well. So yes, there's no general rule separating out autocracies versus democracies. That is true. But so if we look at the ones that did do well, the democracies that did well were the ones that could count on buy-in from their citizens. The Prime Minister of New Zealand used to talk about her team of 5 million. I don't think there are many other countries where there were teams of, however many million people belong to that country. In most other democracies, you had a querulous, cantankerous group of citizens, very few of whom would actually sort of agree on what should be done, what could be done, what they were willing to do, and who sort of, went along for the, sort of pitched in, as it were. So New Zealand was happy they could do it. Australia is actually a very interesting case, because the Australians obviously have been able to count on a lot of buy-in. And look, I'm no expert on Australia. I know what I read in the papers like anyone else. But I'm impressed by the extraordinary firmness with which the Australian government imposed measures on their people. And, normally we think of Australians as being, a bit like Americans, sort of individualists.
As libertarian as they come.
Laissez-faire, individualist. People are used to lots of empty space and doing things their own way, and Crocodile Dundee sort of style. I mean, this is so that doesn't seem to be the case. I mean, in Australia, they have, after all, literally prevented Australians who have every right to be in Australia, who wanted to come back. They've prevented them from coming back, and even more, almost inexplicable, they prevented Australians in Australia who wanted to leave from doing so. I mean, people who had, good business reasons to go or family reasons, wanted to leave, are simply to this day prevented from exiting the country for reasons I honestly don't understand, because it seems to me from Australia's point of view, as long as they don't come back, or as long as they only come back, going through all the quarantine procedures and so forth, why do you care that they leave? I mean, that's not a danger. So I don't quite get it. But I mention it only to point out that the Australians, despite their laissez-faire, rather libertarian reputation, had laws that most other liberal bourgeois democracies, the citizens, I don't think would have tolerated, but they did in Australia. In much the same way as, as the Chinese could count on both a great deal of buy-in and a great deal of exertive power by the authorities to make people stay at home and come for testing and show their ID cards and, all the rest of the stuff that was required for testing and tracing.
So curiously, it seems like Asian or Asian-adjacent democracies did better than Western democracies.
Well, I in this case, I certainly count New Zealand and Australia as part of Asia because they reacted much the same way. Now, we mustn't forget, of course, there are also islands, and islands, with a glaring exception of the UK, had a certain advantage from the get-go. If they were willing to sort of shut down incoming travel, then they could actually sort of quarantine themselves off and preserve themselves. The nations, the Pacific Island nations, very small, of course, and quite distant, most of them shut down promptly, and very few of them have had any serious epidemiological issues. I mean, they've had economic issues, of course, but as a result, but they've done very well for much the same reason.
So one of the cases that interests you most in the book is what would seem to be the great outlier in terms of state responses to the crisis, which is Sweden, which developed early on this strategy of attempting to reach herd immunity. And in fact, you even refer to the Swedish Zonderväg, the Swedish special path. What went on in Sweden, and how can you explain it to our audience?
It is an immense mystery, and oddly enough, it continues to this day. Beginning of April, a book has just come out called "The Herd," which it's going to be translated into English next year by a journalist who sort of explains that despite the fact that the government authorities denied that they were pursuing herd immunity, that is, in fact, as everybody knows, what they were doing, whatever they may have to say. But having done that, he then ends with the most peculiar conclusion, which is that this year, 2020, was the year of Swedish freedom, because the Swedes could swan about, eating out and drinking beer and going shopping and all that sort of thing, while the rest of us were locked up, as though this is some, enormous advantage. I mean, it would be, of course, if there weren't any price to pay. But if you look at the results, the Swedish mortality rates have been absolutely horrendous. The Swedes themselves want to be compared with other nations in Central Europe, Belgium, the Netherlands, the UK, that places, in the thick of things that have had mortality and infection rates that are even worse than the Swedes. But they don't want to be compared to their immediate neighbors, Denmark and Norway and Finland, because compared to them, they are a disaster area. They have 10 times the mortality of Norway and Finland, 5 times the mortality of Denmark. They could have had the equivalent mortalities as their neighbors who shut down if they had done the same thing, but they didn't. And so they, of course, don't want to be compared to them. So the Swedish response was entirely unexpected. I mean, this is, in normal circumstances, how should we put it? They run a tight ship in Sweden. I mean, it's not like, these are laissez-faire buffoons who don't really sort of pay attention. I mean, this is not Brazil. This is not Belarus. This is not a country where they don't, clamp down and have laws and that sort of thing. This is a country that, normally speaking, is, as I say, a tightly run ship. And, their approach was entirely, as far as I can see, self-contradictory, Because on the one hand, they argued that Swedes were so well socialized and self-disciplined that they would know what to do. They wouldn't go out. They wouldn't socialize. They wouldn't sort of, go to bars and hang out and breathe in each other's faces and that sort of thing. They were just on their own without being required to do so, without having lots of rules and police in the streets. They would do on their own what needed to be done. And yet at the same time, they also were firm believers in herd immunity, which meant precisely the opposite, that Swedes had to go out. They had to infect each other. The epidemic had to spread through Sweden because otherwise you wouldn't achieve herd immunity. So they had a sort of completely self-contradictory set of policies where you couldn't reconcile the two parts of their tactics, and yet they did them at the same time. Now, all of this would be entirely uninteresting if we were just talking about one small country of 10 million people, in the distant fringes of the world. But of course, their approach became politicized in the rest of the world. And the libertarian right everywhere else said, this proves that what we're saying is precisely right, and that it is bad to lock down, and that lockdowns are not only a violation of civil liberties, but also, hurt the economy, and that we would all be better off if we hadn't locked down and just let people go about their business. The disease would spread, and we would achieve herd immunity. And the Swedes are sort of the proof that that worked. The Great Barrington Declaration, which was issued shortly before the presidential elections in this country, was sort of, a grouping of global libertarian rightists arguing that herd immunity was the way to go and that Sweden was the beacon. So in other words, it wasn't just sort of one little isolated country deciding to be peculiar. It was something that
right. Well, I mean, this raises the question, given the close association that you've just drawn and do throughout the book between public health response and political identity and culture, does this response represent the death of that illustrious Scandinavian experiment in social democracy, of which Sweden was an exemplar? It would seem to have the traces of that macho-driven hyper-libertarianism, but as you chronicle, the actions seem to be driven by the chief medical expert, this fellow Tegnell. It wasn't a deferral of scientific knowledge; it was an alternative version of scientific knowledge, with reams of data to support it, presumably.
Yes, I think it's too early to call any death knell to any sort of grand pan-Scandinavian approach to these things, because first of all the other Scandinavian countries, took what we would have expected them to do, namely just shut things down in the name of solidarity and preventing the disease from hitting. And they've kept their mortality rates very low, and none of them have, struck out on their own, gone off-piste. In fact, they were all horrified by what the Swedes did. And last summer, when they started sort of opening up, the one nation's tourists they didn't let in were the Swedes. Even the Norwegian and Swedish border is normally very porous, and people cross the border. Norwegians go to Sweden to shop because the prices are cheaper, and they have summer houses in Sweden. All that was was ended because the Norwegians didn't want the Swedes going anywhere into their country, and they didn't want their own people going into Sweden. So Sweden is really being an exception all by itself. Why is it the case that it did so? I think I don't think it's indicative of some great ideological sea change. I think what happened here was that a small group of self-selected, almost self-trained, but people who had trained each other, public health people, ended up running the show, and a weak caretaker coalition government simply made no attempt to intervene and to try to guide things. And so people with a certain bee in their bonnet ideologically were allowed to make all the decisions and were never intervened with. If you compare it to neighboring Denmark, the public health people there had actually similar ideas to what the Swedes, what Tegnell was saying, for reasons I don't know. But the politicians there stepped in and said, no way, there's no way that we're going to sort of leave borders open in a pandemic. We are shutting down because better to be safe today than sorry tomorrow, is what the Danish prime minister said. And so she shut down the country. The Swedish prime minister was notable by his absence. He never sort of, in any sustained public way, spoke out about the epidemic. He left that entirely to the public health authorities. And we're talking about a group of 4 or 5 people, all of whom had trained each other, and who I think just ended up in a little sort of echo chamber of their own.
Well, by contrast, the American president was notable by his presence. And maybe we can turn our attention to the United States, which has its own structural features, and it would seem to me liabilities, which we actually spoke about on an earlier version of Then and Now with Dr. Linda Rosenstock from the Fielding School of Public Health, when we spoke about sort of the absence of a centralized public health system in the United States and a form of medical federalism, which grants or burdens states and local governments with responsibility for really doing the heavy lifting with respect to public health. How did the U.S. Look in your comparative analysis?
Well, the U.S., much like the U.K., has been a disaster area. And one of the reasons has, without doubt, been the lack of any kind of central steering in public health terms from Washington and the president's undermining of the governor's attempts to coordinate. All of that, is pumped down to the state level, which meant that some states took much the same approach as many European countries, and some states, just decided to go cowboy on us and not do anything at all. So the lack of any kind of coordination across the nation was obviously a huge weakness, insofar as whatever one state did, there was nothing they could do to prevent people from other states coming in, or very little they could do. I mean, obviously, some of the northeastern states tried to keep, visitors from neighboring states out, but there's only so much one can do in a federal state system with no internal borders of any sort of significance. So it was a disaster. Inconsistency, in this case, geographic inconsistency, was a serious problem. Now, having said that, I think the big picture that we have to keep in mind is that the public health response is only one part of the response. And it was the first 9 months where we clamped down on public health terms. And some countries there did clearly much better than others. My book ends sort of just with the beginning of the vaccines. And the conclusion then was, so the UK and the US were sort of disaster areas. Let's leave aside Brazil and Belarus and the places that, as it were aggressively disaster areas. Places like New Zealand and Australia and South Korea and Taiwan did very well in public health terms. And the European nations, some of them less well and some of them slightly better. The Germans seem to have done better than most, had sort of managed to keep a lid on it to some extent, not quite as badly as the US, but certainly nothing to write home about. So that was sort of the situation at the end of 2020. Then we got the vaccines. And that was, of course, then everything changed. And here it must be said that, Trump made an absolute and total hash of the public health effort, but he got one thing right, and that was to just throw whatever money it takes at the vaccines to get them done. And they got done. And the same goes, for the UK. They wagered on vaccines and they won. Now, had the vaccines not worked, of course, we would really have been up the proverbial creek without a paddle. But they worked. And not only did they work in a sort of technical sense, then came the rollout. And in the rollout, miracle of miracles, the UK and the US, we weren't the best nations. Israel beat everybody. Israel paid Pfizer 40% premium to get enough supply, and then they just went ahead and did it. No muss, no fuss. But, after that, the US and the UK, much to everyone's wonderment, actually managed to roll this out faster than anyone else. And, knock on wood, barring vicious mutations of some sort, or some kind of relapse, we may slowly be on the verge of exiting as a result.
New York Times columnist David Leonhardt declared that today in the United States and likely in the United Kingdom.
And then look at the flip side of that. The countries that did well in public health terms, New Zealand, Australia, all those, are sitting there without having vaccinated their populations yet. They're still isolated. Taiwan has now had an outbreak because they're unvaccinated. And it's unclear how soon they're going to be able to get out of the, well upholstered and isolated hole that they've dug themselves into. So in other words, the political systems that did well in public health are not the political systems that did well in the vaccines. These seem to be two different sets of, what should we call them, political talents. And, there's been a lot of talk about how the Europeans took, the precautionary principle figures heavily when Europeans talk about their policies. Precautionary principle, you don't take any risks that you don't need to take. You're careful rather than running risks. GM modified foods you don't allow because God knows what might happen until you've tested them up the wazoo and you're absolutely 100% sure. So the precautionary principle makes some sense when you're talking about public health. You don't run risks. You shut down earlier rather than later. You shut down firmly rather than sort of lackadaisically. That seemed to work in a public health in a public health sense. But when it comes to developing vaccines, this is a very risky business. You can throw lots of money at things and get nothing for it. Sanofi, big French investment in vaccines that hasn't yet paid off, although it seems now that they may have a kind of second generation vaccine in the pipeline. GSK, same thing there. Merck, companies lose big on this and some win. And, when you're ordering vaccines, this is perhaps not the time, the way the EU did, to worry about whether you're getting value for money and whether you're paying too much and whether the vaccine companies and the biomedical companies in general are, making bumper profits. These are sort of irrelevant. What you want to do is the vaccine as soon as possible and as quickly as possible. I ran up these figures just the other day. So $100 billion for vaccine development globally is what we spent. The economic costs of shutdown and the pandemic more generally have been about $70 billion a week, again, globally. So in other words, the vaccine costs will have paid for themselves if we end the global pandemic a week and a half early. This would have been a bargain at 3 times the price. It's just a no-brainer that, you throw as much money at it as it takes, because vaccines or some other medical solution were the only way to get out of this, short of that universal global shutdown that we talked about in the beginning, which isn't going to happen. Countries like New Zealand and Australia would otherwise be sitting there from now to kingdom come, isolated and happy, but, by themselves. And the rest of us would be living with ongoing, mortality and infection for years to come.
Okay. Well, in the last segment of our conversation, I want to really turn to the link between public health and politics or political theory, and maybe ask you to play both a clairvoyant and political theorist to construct what you think would be the ideal government response to a episode of this scale. Mindful of all of the things you've mentioned, the dissonance between effectiveness of response to the outbreak of the pandemic and the effectiveness of response in developing a vaccine. There's not a direct correlation between those two sets of responses. Mindful of the current spirit of sort of libertarian individualism in the world, and the needs to attend to Rousseau's famous general will. What pieces need to be in place in terms of government authority, institutions, and the responsibility of the individual citizen for an effective response?
Governments need to be decisive, firm, and highly interventionist. All democracies, let's just stick with the democracies for the moment, because the autocracies, we know how they can work if they want to. All democracies have on their books emergency laws, and especially contagious disease laws that apply specifically in emergencies. The dirty little secret of democracy is that to save it, you've got to set it aside in emergencies in order to prevail. And that's effectively what we've been facing. So the first thing I would say is that nations or their governments have to be decisive and willing to use the powers that they have. That we've seen in Australia, that we've seen in New Zealand, and certainly in the other Asian nations. Conversely, you've got to convince your citizens that they should trust you, the authorities. And that is obviously the Achilles heel of modern multicultural liberal bourgeois democracies, that there is a fundamental lack of trust and there is a fundamental lack of an assumption that people will understand implicitly what it is they have to do and sort of pitch in. Now, that's not to say that most people didn't. The dirty little secret in the beginning of the lockdown was that many governments were actually doing less than what their citizens wanted. There were public opinion polls, showed that people wanted governments to do more. And if you looked at, Resi and reservation, online reservation things, people were canceling reservations or not making them for dining out long before governments had forbidden them to do so. So people were sort of, isolating themselves already before they were required to do so by governments. And I think in the beginning of the pandemic, had governments shown themselves willing to impose measures of isolation and lockdown and explained to the population why it was necessary, why this was a short, sharp, painful measure that would actually make things better in the long run, there would have been more buy-in. As things dragged on, of course, because lockdowns were only sort of partially imposed and therefore didn't really work and were leaky and so forth, then of course people get impatient. And after a while, a certain, frustration and tiredness grows, and therefore, this vicious circle and things stop functioning. At the same time, it is also the case that there's been an awful lot of talk about civil rights in the midst of a pandemic that, in an ideal world, is a discussion we wouldn't be having right now. I mean, the idea that track and trace apps on our phones are some massive violation of our privacy seems to me to be an absolutely perverse argument to be making in the middle of a pandemic. Tracking and tracing is a very complicated, very intrusive, very privacy debilitating form of intervention, but absolutely crucial for contagious disease. And in the old-fashioned way of doing it, where you had to call people up or track them down at their homes and make sure they were staying in and finding out whom they'd seen, that sort of, it's enormously invasive, it's enormously manpower consumptive, and just basically impossible to do. Now we all have mobile phones, and an app would have made it infinitely easier, would actually have made contact tracing possible. What's the first reaction to contact tracing apps? Oh no, we can't possibly do them because they follow us around and they track our privacy. Every person who hasn't turned off Google Maps' ability to trace wherever they go suddenly decided that when the government was able to do that then it became a sort of gross violation of their civil liberties. And as a result, contact tracing apps were basically rendered impossible to use in Western democracies. Same with masking. The idea that wearing a mask is somehow a violation of your civil liberties, I just do not get. We have seatbelts, we have bicycle helmets, no shirt, no shoes, no service. That doesn't seem to bother anybody. But, putting on a mask, that is somehow, again, a sudden gross violation of liberty. And when these are the sorts of issues that government authorities are dealing with, this is the sort of population that you have unwilling to cooperate with even something as sensible as a contact tracing app or wearing a mask, then you have to ask yourself, how seriously are people taking? Do they really want to be saved? Or what is one supposed to do in these circumstances? And there, I don't have a good answer.
Okay, well, I'm going to ask you if you have a good answer to the last sentence in your book, which could be the topic of a whole other hour, but will have to be resolved in a matter of a few minutes. You write in your last sentence, the solution has to be global or not at all. So you spent a lot of time talking about the responses of state organizations and authorities. And I'm wondering if by your final sentence, you mean we need to rethink the bounds of state sovereignty and fortify international institutions such as the World Health Organization and others.
Well, it would be good if we could, but I don't see that we can in any realistic sense. I mean, the reason why states are the ones that have to, or that did the heavy lifting here, is that states are the ones that have the power to make people do what they don't want to do. And that is, for a contagious disease, unfortunately, one of the only ways of combating them. So in that sense, only sovereign nations with control over their citizens are able to be the players. Now, that doesn't mean that international organizations, which definitionally don't really have any sovereignty over the people they come into contact with, can't be useful. The WHO of course, ought to be beefed up, and it ought to sort of correct the mistakes that it made during this pandemic. There are other organizations that aren't necessarily international, but that function in effect as international organizations, like the CDC, which used to be, although it's paid for by the American taxpayer, functioned as a global organization. It too did very poorly in this pandemic, and it too ought to be beefed up to prepare us for the next one. So it's not that there aren't roles for international organizations, but clearly what we now know, what we need is some kind of international sentinel system that picks up when new infections first pop up and then is able to trace them as they spread. And if we had that kind of information that national governments could then act on, there is something in Wuhan that we know already about in late December, and by January it's already in New York and in Italy, or wherever the first places were, then we could act on it. Part of the problem was lack of information and the slowness of its spread. So it would certainly be possible to set up some kind of international sentinel network that would at least allow us to be alerted to the next problem that is going to come across our transom inevitably.
Okay. Well, on that note, I would like to thank Professor Peter Baldwin for joining us for a most illuminating conversation. He's the author of Fighting the First Wave, Why the Coronavirus Was Tackled So Differently Across the Globe. Peter, thanks so much for being with us.
Thank you for having me.
And thank you for joining us on Then and Now. Special thanks, as always, to our producer, Maya Ferdman. Wishing you all a safe and healthy day.
Thank you for joining us this week on Then and Now. Then and Now is brought to you by the UCLA Luskin Center for History and Policy, where we study change to make change. For more on our work, follow us on Twitter and Facebook at our handle, @LuskinHistory. Our show is produced by Maya Ferdman and David Myers, with original music by Daniel Reichman. Special thanks to the UCLA History Department for its support, and thanks to you for listening.